day. He came to the world in the usual way, but there were planes to catch and bills to pay. He learned to walk while I was away, and he was talking for I knew it. And as he grew, he'd say, I'm gonna be like you, Dad. You know I'm gonna be like you. And the cat's in the cradle and the silver spoon, little boy blue and the man on the moon. When you're coming home, Dad, I don't know when, but we'll get together then. You know we'll have a good time then. My son turned 10 just the other day. He said, thanks for the ball, Dad, come on, let's play. Can you teach me to throw? I said, not today, I got a lot to do. He said, that's okay. And then he walked away, but he smiled every time and said, I'm gonna be like him. Yeah, you know I'm gonna be like him. And the cat's in the cradle and the silver spoon, little boy blue and the man on the moon. When you're coming home, Dad, I don't know when, but we'll get together then. You know we'll have a good time then. Well, he came from college just the other day, so much like a man, I just had to say, son, I'm proud of you. Can you sit for a while? He shook his head and he said with a smile, what I'd really like, Dad, is to borrow the car keys. See you later, can I have them, please? And the cat's in the cradle and the silver spoon, little boy blue and the man on the moon. When you're coming home, son, I don't know when, but we'll get together then. Yeah, you know we'll have a good time then. I've long since retired, my son's moved away. I called him up just the other day. I said, I'd like to see you if you don't mind. He said, I'd love to, Dad, if I can find the time. You see, my new job's a hassle and the kids are the flu, but it's sure nice talking to you, Dad. It's been sure nice talking to you. And as I hung up the phone, it occurred to me, he'd grown up just like me. My boy was just like me. And the cat's in the cradle and the silver spoon, a little boy blue and the man on the moon. When you're coming home, son, I don't know when, but we'll get together then. Yeah, we're gonna have a good time there.
Don't you love music from my generation? We were so calm and quiet and peaceful. What do you think? Someone speak to me.
I agree.
You agree? Thanks. Yeah.
My grandmother sent me some frosted or mini wheat thins.
Cool. Share
Oh,
them,
yeah.
please.
Share them.
So how are we today?
Good.
Okay.
Everybody's good? Who's going to be our next president?
It's up to Nevada now.
It's up to Nevada. Does anybody feel really confident about anything? Why do you think that is? Why do you think we don't feel confident?
Because a lot of places that should have voted one way voted a different way. And people are very thrown off right now.
Yep. It's really interesting. I think it's because I have vivid memories of 4 years ago when we thought we knew what was going to happen, and then all of a sudden it backfired. So I'm like, I refuse to think anything one way or the other. Let me know when it's over. Right? Pretty crazy. Pretty crazy. So somebody tell me something good.
I did well in my piano test today.
That's great. I'm
Ah,
proud of you, buddy.
No,
I'm
you're
not
gonna
talking to you, Brad.
say it again.
Oh, my roommate answered me, so I told him that I wasn't talking to him.
Oh, okay.
Fuck me.
So someday you're gonna play the piano for us, Patrick.
Absolutely not.
Ah,
I'm very bad at the piano.
Play the piano.
David, you should play the piano.
We're all bad at the piano.
you all have to play the piano.
Yeah, it's a degree requirement for all the music majors.
How do you think that is?
It's really helpful for understanding music theory, and it's also if you're like a music education major especially, it's really helpful to know piano, like if you want to like accompany students for their solo pieces, or if you're like a choir director, you need to be able to play piano to accompany the choir.
Or
Things like
to demonstrate different chord voicings or to demonstrate what the ensemble's doing. It's a lot easier to be able to just play it. Still sucks to have to take 4 semesters of it though.
4 semesters?
Yep.
Yeah, we're all in our third at this point.
You're your third. So
Next
you ought to be
semester's the
really
last
good at
one.
it by now. That's interesting. I tried to play the piano. You know that I'm like tone deaf. I mean, literally. But I was in band for 4 years. I played the flute, right? Which you can do if you're tone deaf, if you just, I don't know how you do it, but I did it. But then I decided I was going to play the piano as an adult, and it was a disaster. I can't make 2 hands think differently. So it was very disappointing. Seems like a very calm thing to do. While we're talking about music, after we hang up, I always think, wait, let's talk to me about special ed and band choir. So if you're going to teach, let's do high school stuff. So think about if you're going to do high school stuff and you're going to teach music, whatever that looks like. How do you feel about kids with disabilities with you in those classes, courses, activities?
It's sometimes challenging because it's a non-traditional academic setting.
Yeah.
So you've got to be a little bit more creative about how you reach out and include those students. It's less cut and dry, I think, in terms of the way you have to gauge their achievement level at any given point is a little bit different than in a traditional sit-down academic setting. So I think you have to take extra care and time and creativity to figure out what role in the ensemble they can play, and not just how they can contribute, but how they can feel valued.
Right.
Because sometimes, you know, I don't know, I feel like putting a kid in the back corner to sit and do something out of sight like is never necessarily a good thing. But you know, you also, quality is still an important aspect when you're directing any given ensemble. So it becomes a question of how do you include somebody who might have a different capacity at a given moment without compromising the integrity of the ensemble.
I agree, 100%. Someone else? So I've told you about, remember there's different ranges of disabilities too, because what if you had a child with autism, and I can, it's so funny, my mind's going, ching, ching, I can think of all these kids. So let's think about if you had a child with autism that was talented musically. So that person could be a benefit both to you and then the other way around, right? You could definitely be a role model, but how would you handle that?
I mean, I actually help teach my brother piano, and he has autism. I mean, I've learned some things like since I started doing that, like I have to obviously have tons of patience, and uh like too much at once. Like usually when I practice with him in the evenings, um I only do it for like 10-15 minutes like max.
For short
Um
periods of time.
and then his lessons are like 30 minutes a week. Um and I often have to, usually I like for a rhythm, like I point on the sheet music to like so he follows along with it, and I like demonstrate things they doesn't understand, things like that. It's, I mean, I think some people may find it like I think it's just different, honestly. Like it's a different kind of challenge. It's not really
Mhm.
too much harder like than people think.
It's
That's
about
just my opinion.
differentiating. It's about
Yeah.
differentiating, right?
Yeah,
There
like you just have to find different strategies because obviously like no two people are the same, right? Like whether they have a disability or not. So like you have to find what learning strategies work for them, you
Yeah.
know, and go from there.
And that will be the same across all disabilities. I just really want to encourage you guys to experience that for yourself and for kids with disabilities, right? If you end up in that position. I was thinking, see if I can find a video really quick. When David was talking about a friend of mine who has a son who has Down syndrome, and he was in band um, all the way through high school, and then he went to Lamar, which is interesting, in Beaumont, Texas. You've never heard of Lamar, but it's a university. But he played the drums, but he played the drums from the sidelines. See if I can find. And we need to talk about the social benefits of that for him and how it benefited others. Let's see if I can find it. Oh, yeah. Let's see if I can find the video. It's been a while since he was in high school. He did more in high school than at the university. Patience. Maybe I won't.
One, two, three.
All right, share a screen. This is not, I was trying to find a picture, a video of football games because that's where I always was impressed. But this is, you can see my screen? Speak to me.
I thought it was really interesting that that he was uh that he was off to the side like that, as
Yep.
opposed to in I guess formation in the drill with everybody else.
Yep.
Um, and it's I don't know, it's not something I as an instructor would have thought to do because I guess I would have assumed that, you know, that would make him feel ostracized or alienated, but he seems to be having a great time. So, you know, I guess whatever makes him happy, you know, is what you got to go with.
Yeah, it surprised me too. The first time I saw it for a couple of reasons. We had time to go through his history that I've seen via pictures, right? He wore noise canceling headphones a lot of his life because loud noises bothered him. So when we first started seeing him in the band, he had the headphones on, which was really funny, right? Because he was kind of off to the side. He was on the sidelines. He wore a uniform. He stood on the sidelines when they marched on Friday night. But he always had those headphones on. So to watch him lose those headphones along the way speaks to socialization, right? Just the experience of being around that environment and being accepted. So yeah, I would have never thought to do that either.
It's a kind of an aside, but in an enclosed indoor gym environment like that, when everyone's playing at the same time, they probably should be wearing headphones of some kind. But
You know, it was at a pep rally, right? You guys have pep rallies in the state of New Jersey? Well,
yeah, it's disgustingly loud.
that's really loud. I had a student that had autism. Well, he had Asperger's, super high functioning, but he could not stand to go into pep rallies. And they tried to force him. It was a huge ordeal. But I mean, yeah, for those same reasons, it was more than he could handle. So, okay, let's talk about physical disabilities. I had it all open and I lost it.
I just have a quick question. Is our interview project due tomorrow?
Is your interview project due tomorrow?
Because I think you mentioned it once, but I don't see like any like solidified date on Canvas.
There's no due date on Canvas at all?
Not that I find. I don't know if anyone else sees one.
On the syllabus, it says that it's due November 6th, but I don't know if there's like a place to submit it or anything.
Okay. If it's due November 6th, if it's due November 6th, you guys need more time? I'm getting yes, I'm getting no. I can give you till Monday if that helps, and I can make sure there's a place to upload it. It should be under assignments.
Yeah, I went to assignments and then just clicked it, and there was somewhere to submit it.
Well, there is. I haven't looked
Yeah.
at yet because I'm not done yet, but that's good.
Yeah, if you just go there, it's there.
Okay, thank
Do
you.
assignments.
Look, I did something right, and y'all are stressing me out. Does it have a due date on it?
I'm not sure. I submitted it early, so I didn't really. It says it in the syllabus, so I just looked at the syllabus.
Okay, so I need to check the assignment tab because if I had it due tomorrow on the syllabus, it will probably lock tomorrow. If you need more time, give me a thumbs up.
I was gonna say there's no due date written on the assignment, so you're not gonna see it on the dashboard, but it is there. It's under assignments. Yeah.
Well,
But
I'll
the
make
due
it
date
Monday.
is written on the syllabus, though. If you scroll down a bit, yeah.
Monday it is. Any other questions before we begin?
Is that for the individual or for the group?
No, individual.
Okay, thank you.
And the group will usually do as presentations. I think we should do that on Thursdays. I feel like you should really present to us. So we'll do that on Thursday nights. I think it's scheduled that way already, right? In the syllabus. Yeah, so that's what we'll do.
I had another question
Sure.
about the past project, the book report project.
Yeah.
Which was since only one person submits it, when do the rest of us and how do the rest of us like get our grades for that?
So your name should be on the project that was submitted, right?
Yep, yep.
Yep, and your grade will show up in the grade book one miraculous night when I have time to take care of that.
Okay.
It will show up and you'll be like, oh wow, I was on top of it in the beginning, and then this past week things got crazy. The past couple of weeks, but hopefully things will calm down and I'll be able to get to it quickly.
No worries. I'm there with you.
Wow, this is crazy times. Anyone else?
So just to be clear, it's due Monday now for the
Yeah.
individual part, like the
Yeah.
paper. Okay. All right, thank you. That's helpful for me too. So
Good. Love to be helpful, right? Okay, log in. You guys need to log in now because I keep struggling to find where you've completed the Nearpod. So now log into TNJ I5. Ready? It says I have 6 people. Wait, let me refresh. 10 people. There's more of you here than 10 people. What if I refuse to move forward until you all sign up? I also can't move your pictures. Okay. You're ready. Give me thumbs up. Everybody whose face I can see is ready. Oh, look at y'all go. All right, here we go. Now I have 12 at least. Drums again.
Yes, I can, suddenly, yes, I can. Gee, I'm afraid to go on has turned into, yes, I can. Take a look, what do you see? 133 pounds of confidence in me. Got the feeling I can do anything, yes, I can. Something that sings in my blood is telling me, yes, I can. I was just born today, I can go all the way, yes, I can. 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 Hey, yes, I can. No, you can't. Yes, I can! I can climb Everest. Yes, I can. I can fight your night and never rest. Yes, I can. I was just born today. I can go all the way. Yeah.
what are your thoughts?
I think it was just interesting because, like, for me personally, I'm used to watching the Olympics where the people aren't disabled. So it was just cool to see people with different disabilities that have awesome abilities. So that was nice.
Exactly. Yep. That's a good way to put it. They have awesome abilities, right?
Also, it was really like happy and uplifting.
It was happy.
Positive.
Do you ever think about people with disabilities and the things that they can do and think, well, I shouldn't have any reason to complain? Yeah, I think we've all done that, right? In fact, I heard it recently. Someone was talking about something I can't remember, and they were like, "So I have no reason to complain." And I was thinking, that's interesting, because listen to this person's. Have I shown this to you guys before? I have already shown it to you. So talk to me about her attitude. You've all seen it. I'm gonna get her started. Sheila Young, right? So talk to me about her attitude about us using her as an example of as an inspiration, for example. Does she feel like we should use her as an inspiration?
No. If I'm not mistaken, I think that she got like an award for being like a good citizen or something in her town.
Yes.
Parents were like, why does she deserve that? She's done literally nothing except live.
Exactly.
So I think it's interesting. We treat people sometimes like they're overcoming something so big. Meanwhile, like they don't feel any different. They're just like living their life.
Right.
So
how does that compare to the video that we watched before with the athletes?
Well, that's different because they're actually like talented.
Yeah.
Do something cool that like most of us able-bodied people can't do. Like I can't play basketball, but
they're impressive.
She's just living her life, doing her thing, doing nothing special, really.
Exactly. So they're impressive because they really have ability above and beyond, right?
Yeah.
Doesn't really have anything to do with the fact that they have disability. Something to think about. It gets confusing when you think that way, right? So how many special ed categories are there? You guys should be able to say this all together. How many special education categories are there that you can be eligible for special ed under?
13.
13. And in New Jersey?
14.
So today we're going to talk about different forms of health disabilities and physical disabilities, the things probably that you've heard about before. And these kind of tend to be the things that we think about a lot when we think about teaching special ed, but yet the things that we see the least. So if you do the timeline, the book starts talking about William Little, who talked about cerebral palsy in 1861. And then in the 1900s, there was a public class for children who were crippled. Way before we had IDEIA passed, right? In fact, the Rehabilitation Act, Section 504, was passed in 1990. So if you think about the early 1900s, people didn't really have a problem with kids with physical disabilities going to school, right? It was really more about people with cognitive disabilities, behavioral disorders. Yeah. Why do you think that would be? That there would be more discrimination against people with cognitive disabilities, behavioral disorders, multiple disabilities? What do you think the thought process was about them going to school?
I mean, with people with just physical disability, I mean, I guess it could have been seen as like their brains were still very coherent and they could still respond just as easily as somebody who doesn't have a physical disability or as somebody with an intellectual disability. They just required the extra assistance where that might have not have been seen as I don't want to say appropriate, but people didn't know how to handle it then.
When I started school, long time ago, they talked about kids who were educable. So there was educable, can't even hardly say it, students who had MR, mental retardation. So the idea was that if your IQ was below a certain number, that there was nothing for us to teach you. There was nothing you could learn. So yeah, so that's kind of how the physical disability becomes more accepted. There's different types of physical impairments, and IDEA covers it in a couple of categories. Orthopedic impairments is one area, so that you would think orthopedic impairments would mean what? What does it mean to have an orthopedic impairment?
Like something with your bones?
Yeah, with your bones, right? So it's students with physical disabilities have problems with the structure or functioning of their bodies. Some caused by congenital anomalies, disease, cerebral palsy, amputations. The people we saw, right, have physical disabilities. We also talk about other health impairment along with physical disabilities. In order to fit in the category of other health impaired, students have to have limited strength, chronic or acute health problems that affect their educational performance. So what category or what mental health disorder do we say fits under OHI, other health impaired?
ADHD.
There you go, ADHD. Sometimes it really doesn't feel like it fits under this these categories, right? Okay, we just talked about those things. So there are different types of physical disabilities. Some children are born with, sometimes things happen and cause physical disabilities. So neuromotor impairments are conditions that involve the nerves, muscles, or motor functioning. What is motor function? Does that mean your car breaks down?
Like movement?
Movement, yeah. It's about walking, using your arms, using your hands. So it includes seizure disorders, cerebral palsy, spinal cord disorders, polio, muscular dystrophy, multiple sclerosis. What's the difference in muscular dystrophy and cerebral palsy? What is cerebral palsy? Google it.
I think if I remember correctly, it's like an impairment in the brain's functioning for like delivering motor messages to your muscles and your bones.
So it has to do with, yeah, muscles, bones. And what is muscular dystrophy? Do you know what the word dystrophy means? So people that have muscular dystrophy, their muscles start dystrophying, becoming weak over time, and slowly but surely they lose function of their muscles. Oh, what did I skip? You also have, so in addition to nerves, muscles, we also have musculoskeletal conditions, juvenile arthritis, limb deficiency, skeletal disorders, health disabilities. So there's kids who have asthma. Have you ever known anybody that had asthma? Yeah. Have you ever known anybody that had severe asthma? So talk to me a little bit about that. Because you probably will teach a child with asthma.
My brother, he's 8. He has severe asthma. So like at school, my mom has to send nebulizer treatments and his inhaler because if he runs too much on at like recess or even in gym, it gets to the point where the coughing is so intense that he can't breathe.
Yep.
So he has to be really careful.
Yeah. One time when I taught, we had to call an ambulance for a kid with asthma because he couldn't breathe, and it went on and on and on. It was bad. So those are things that you need to know about if you're going to teach special ed, right? Tuberculosis, childhood cancer, cystic fibrosis, congenital heart defects, blood disorders, diabetes, infectious diseases, HIV and AIDS, hepatitis B, storch. What is storch? It's my favorite. I just like the name. Look it up, see what it is. What does storch sound stand for? Anyone find it? It's in your book. I know you read the chapter. Let me help you. Ooh. Let me know if you find it. Wow, that's not.
Is it just like a an acronym for a handful of different
Yes.
like congenital infections, like, so what does it say? Syphilis, rubella, herpes simplex, some others.
Yep, that's it. Do you know what the others are?
I don't necessarily know how to pronounce them. I read them.
Good for you. Okay, so this is what I want you to do. I want you to, how many of us are there? 4, 16, 17, 18, 19. So pick, this is so hard to do. I'm like, pick a partner. How y'all gonna do that? I don't know how you're gonna do that. All right, let's do it this way. I'm going to attempt to put you into rooms together. And you're going to, and so listen to me closely. And when I say something you're interested in, just write it down. You're going to look up whatever I tell you, whatever you pick, and then you're going to come back and tell us about it. Okay. So someone do cerebral palsy. Someone say, I like that.
I'll do it.
There you go.
Sabrina.
So whoever's with you. Polio.
I can do that one.
Okay. Muscular dystrophy.
I can do that.
Multiple sclerosis.
I'll take multiple sclerosis.
Good job. You can say it, you can do it.
My Nana has it.
Who has it?
My grandmother.
Grandmother. Okay, good. So you can tell us about it. Asthma.
I'll do it.
Tuberculosis.
I can do it.
Childhood cancer.
I'll do that.
Don't even want to touch it, do you? Good. Diabetes. Diabetes.
I can do that one.
Okay. Who's left?
I am.
All right. Zoe.
I also am.
Oh, lots of people. Okay. So childhood, HIV and AIDS, hepatitis B. Did
I'll
someone
do
pick?
hepatitis B.
Good.
I could do HIV and AIDS.
Good. Remember, you're doing childhood and storch.
I
I guess I'll do storage.
Good. All right. Watch me try to do this now. Here we go.
Can I do like childhood seizure disorders since that one wasn't covered?
You can. Did I skip it?
Yeah.
It's an important one. It's one I usually talk a lot about. Good. Yes. That's an excellent idea. All right. Then you're going to go into Flipgrid and record a response. So I'm going to attempt to see how this works. If you end up with a partner, y'all can pick either one's topic or both and then record it. We tried this before, right? Y'all figured it out. So this is the Flipgrid. What do you need to know? The code. See the code? Oh, there you go. Right, I'm going to stop sharing so I can put you in rooms. You have this long code written down somewhere. Here we go.
What am I doing?
Yeah, I don't have one either.
Do it with whoever you're in the room.
I also don't have one.
How many people have said that? 3? 4? All right. So if you end up in a room with someone that doesn't have one, pick one. It's so much easier to do in person. Assign automatically. There are. So there are 20 of us. I want you to go into 10 rooms, right? Ready? It's my favorite part. See ya. Are you back?
Yeah.
Did you learn something new and exciting?
Yeah.
Did you make your recording?
Yeah.
All right. So we're going to listen to your recordings briefly. Let's see what that looks like. I think I should get a lot of credit for all this fancy. What do you think? Yes. Okay, you can see, right? Here. I want to refresh. Let's put y'all over here. All right, we're gonna start with Aaron. You ready? This is so fun.
I can't hear anything. I don't know about anybody else.
I just comment the one time I tried to do Flipgrid responding to a class, that's what I looked like. It's hard. All right. So Aaron, you guys are gonna have to tell us what you said, unless we can hear the next.
So Christina and I had TB, childhood tuberculosis. So we were explaining what tuberculosis basically is. It's basically like an infection in the lungs that's spread through a specific form of bacteria that can affect other organs too. It's generally spread through the air. There are 2 forms. There's the latent form of the infection and the actual disease. People with like diabetes or HIV are at a higher risk for it. Generally, children around age 5 are at high risk, but those who are at like 10 are also at risk too. Generally, the symptoms are like cough, weight loss, fever, chest pain. You can get tested and like get an x-ray. You can take medication for some of it. And there's also a vaccine. That's
So,
basically all that we talked about.
so if you have a child in your class with TB, what is that going to look like for the child? Are they going to be in your class?
I think it would depend. Probably not, though.
Super contagious. So as we go through this, I want you to think about children and the impact on their education. So in this case, the impact would primarily be that they're not going to be at school, right?
Hi everyone, I will be discussing childhood asthma. Childhood asthma is when the lungs and airways become to easily get inflamed when exposed to certain triggers such as inhaling pollen, catching a cold, or other respiratory infections. Childhood asthma can be bothersome on from day-to-day activities and can cause daily symptoms. For instance, like children, when they're out in the recess yard and they're running around too much, their asthma can begin to cause issues and their lungs and airways may begin to close. It is very important for children to have the right supplies, such as medications and an inhaler handy, so that when they do feel like they can't breathe and are having trouble, that they have something at the tip of their fingers so that they can reduce that feeling and open up their airways. Childhood asthma isn't much different than adult asthma, and unfortunately childhood asthma cannot be cured. As one grows and develops, asthma does follow with them, but as one does get older, their lungs may begin to get stronger, so they may be able to withstand more activity without feeling like their lungs are collapsing. It's very important to have medication on hand, because if not, it could begin to be an emergency situation where one has to be sent to the hospital to undergo specific treatments to help open up those airways. So yeah, that's pretty much what I read about childhood asthma.
So what did you hear from her that about school? What's the effect on school of asthma on you as a teacher plus the kid? What do you need to make sure you have if you have a child in your class with asthma?
You have to make sure they have their medicine. And it's always like, I know with my brother, my mom had to always constantly make sure it wasn't expired, because that was a big issue. And I feel like obviously you can't, as a teacher, control what the child's doing at recess or something, but I think it might be important to pay attention to if they're running too much, or like checking how they're breathing, just like to see, so you can have preventative measures early on.
Excellent. So with all these kids, the nurse is your best friend, right? You want to know from the nurse what you need to know and what you need to do if there's a problem.
Hey, so I worked with Jake, and what we were doing was researching hepatitis B. So hepatitis B is a liver infection caused by the HBV virus. It can be spread through blood, open sores, and the mixing of bodily fluids. It can manifest a couple of different ways. It can be acute, which is lasting anywhere from a few weeks to a few months, or it can be chronic, which is lasting more than 6 months, basically just like forever. And what hepatitis actually means is it means it's an inflammation of the liver, is what the word hepatitis means. It's more common in guys than in girls. And chronic HBV increases the risk of both liver failure and liver cancer. There is a vaccine and there are treatment options, but there's no actual cure. Once you have it, you kind of have it. It can be transmitted through a couple of different ways. It's an STD, so it can be sexually transmitted. But it can also be transmitted through dirty or unclean needles, like the mixing of bodily fluids, like blood. It can also be transmitted through childbirth. If a pregnant mother has it, she can pass it on to her kid, I think, through breastfeeding. Signs and symptoms. There are a lot of these, straight from a Mayo Clinic. There's abdominal pain, dark urine, fever, joint pain, loss of appetite, nausea and vomiting, weakness and fatigue, and jaundice, which I think I'm saying that right, is when like you get really anemic and your skin starts to turn a little yellow and it's kind of gross. And on that happy note, that's hepatitis B.
So for hepatitis B, what do we need to know about a child in our classroom?
They can't get their bodily fluids on anybody.
Good, Sabrina. So what does that mean for a teacher? There's a lot of these that you'll think about some of the things that we're doing now that we didn't used to do, but what?
I think it's important for the teacher to know if a child does have hepatitis B, so that maybe they're a little sensitive about it, or if they're self-conscious, and the teacher can understand that they're going through a disease that they have.
So it's contagious also. So you're going to need to wear gloves, take care of yourself, and be careful to be sensitive, right? I can remember, it's so funny, you guys won't believe this, but I remember when they started making us wear gloves when kids were bleeding. That was not a thing back in the day, or when a kid threw up. I mean, I was teaching kindergarten. I mean, I don't know, 5-year-olds throw up. I don't know for what reason, but that's a common occurrence, right? And I got so upset because they said we had to put gloves on. Because it was like, what am I going to do? I'm going to say, okay, honey, wait right there while I get my gloves, right? But now it's just common sense that we take care of ourselves as much as we take care of kids, right? So those are things to think about.
Hello, everyone.
Hi.
So my topic was cerebral palsy, and I found that it is a congenital disorder of movement, muscle tone, or posture. Cerebral palsy is due to abnormal brain development, often before birth. The symptoms include exaggerated reflexes, floppy or rigid limbs, and involuntary motions. They appear early in childhood, and long-term treatment includes physical and other therapies, drugs, and sometimes surgery. All right, I'm gonna flip the camera and figure out how. All right, there you are.
Good. Okay. I had seizure disorder, and the most common two types are the grand mal or focal or partial seizures, and then there are general seizures. So you typically hear about epilepsy, and epilepsy is a brain condition that causes a child to have seizures. It is one of the most common disorders of the nervous system, and it affects children and adults of all races and ethnic backgrounds. Essentially what happens, you can have convulsive and non-convulsive. Convulsive is your typical, you see the person usually laying down with the flailing limbs, and then non-convulsive, it kind of looks like they just, I guess, black out or just drop to the ground. And people tend to have auras involved with their seizures, which common ones are dizziness, a metallic taste in their mouth, and a general headache.
Good job. So CP, what are you going to do as a teacher if you have a child in your room with cerebral palsy? What does it mean for you, for a child?
The one person I know with cerebral palsy is in a wheelchair, and they're like strapped down, and they have an aid wherever they go.
So it's primarily about body movement. It's important too, though, to remember that it's not always associated with a cognitive disability.
Mm-hmm.
When we see kids that are, when we see kids with body movements that it looks like they can't control them. Remember one of the people in the video about the institution, there was absolutely nothing going on cognitively, or there was everything going on cognitively. He was doing just fine. He just couldn't speak because of muscle activity and all of those things. So be careful what you think. That's the big deal with that. And there are ways for them to communicate. All those things are super important. And seizure disorders, that's the one thing that you probably will know someone with, or teach a child with a seizure disorder. So what do you need to know about seizures?
Actually, I used to have them when I was between the ages of like 13 and 15.
Yep.
So they gave me, I don't know if I'm assuming most schools do this, but I was given like a special nurse's slip So if I had any of the auras, which like I said, my typical ones were the headache, dizziness, and the metallic taste in my mouth. So if I tasted like I had pennies in my mouth, I would just show my pink slip and I'd be able to leave.
You left by yourself?
Well, yeah, I mean, I was in high school, so I guess it was kind of like they trusted me. I was kind of like, oh yeah, I know what's going on. But another thing was that I was non-convulsive, so it was less of an issue of me convulsing, and the common thing is you bite your tongue, whereas I wasn't like that. It would look like I was just going to sleep.
Right.
But whereas I think the convulsive ones would be a little bit more concerning, just for safety reasons for not only the child but other children in the classroom too. So it would have to be, you'd have to make sure that that child, you have to clear the area as if you were giving CPR. You don't want anybody else involved, even if you think, like, you don't really want to necessarily hold them down, because that can hurt them and other people even more.
And don't put anything in their mouth. There used to be a thing about putting a stick in their mouth so they didn't bite their tongue. That we don't do that because they can actually hurt themselves with the stick in their mouth. Yeah, the first year I taught, I had a 5-year-old that had what we called stare seizures, petit mal seizures. And so he would sit there and he'd be gone. And then he would fall and sleep. It always happened when we were on the circle, but it scared me. But I soon learned that it was okay. I was just supposed to let him sleep. So that's what I did. Jasmine?
I remember when I was in middle school, there was a student in some of my classes who got seizures pretty frequently. And I remember my teachers, they would usually like once or twice a year, like the school nurse would come around and like educate me and my classmates about seizures. It's only in the classes where that student would be present, or any other student that had seizures from time to time. And like the main thing they would say is like to not panic and like, be calm. Because sometimes they can be like nerve-wracking for the people around them because you don't know what's going on. And some seizures can be really serious. So the main thing they say is like to be calm and like don't panic and like ask for help if you notice something that's like in a student that might be a seizure or so I just think it's like educating the classmates themselves is important too.
Super important, because there's so many things. Sometimes kids are embarrassed when they come back, when they come out of the seizure. You don't want that. The other thing is other kids can become really panicky. So you have to be calm and all together. The big thing is to be prepared. Make sure you're going to know if you have a child in your room that has seizures, and you just want to be prepared for how you're going to handle it. And you can do that.
Hi, my name is Lexi, and I just wanted to talk about cerebral palsy. Cerebral palsy is a group of disorders that affect a person's ability to move, meaning it's a motor disorder. According to the CDC's website, it is the most common motor disability in childhood, and it's caused by an abnormal brain development or damage to a developing brain that affects a person's ability to control his or her muscles. Depending on how severely the brain is affected, it is possible that the child or individual with CP or cerebral palsy does lose or affect their ability to speak.
Excellent.
The disability I'm going to be discussing is asthma, and asthma is when your airways get inflamed and it causes difficulty in breathing. There's different severities of asthma. You can have severe asthma where you can't breathe in most physical activities. But most people have minor asthma, and people can get it as a child. And it just kind of causes complications when doing things that raise your heart rate or cause you to breathe heavy. And it's usually found when you're a child, and you can get inhalers for it, and there's different treatments, but it's definitely a difficult health disability to have. And that's it.
All right. So you'll know kids with all of those disabilities, and it's okay. You just have to be prepared and calm. Everybody be calm. So let's see if there's something on here you guys didn't teach us. We talked about epilepsy. If you've never seen anyone have a seizure, you should Google it and watch it happen and think about how you would respond because it is frightening. I worked at a day treatment mental health facility one time, and we had a teenager who ate things that you weren't supposed to eat. So she would eat the foam out of the couch, which I didn't even know there was foam in couches until I met her. And she had epilepsy. And she had grand mal seizures. So if she ate the foam, guess what happened to her medicine? You had foam in your stomach and you took your medicine. What would happen to your medicine?
She like throw it up and then
It would be absorbed by the foam. It like wouldn't absorb into your body.
It was absorbed by the foam. So it was like she took no meds. So she would have these horrible seizures and it was really frightening. But yeah, so she was getting all kinds of different treatment. That's why she was in day treatment, but it was scary. So it's important that you have seen it, that you have an idea of what might be going on. Absent seizures, that's what I was talking about a minute ago with the child that stared off into space and then just went to sleep. So I had to learn to really be aware that that was going to happen or could happen because he could have hurt himself, right? So it's just about being aware. You probably won't watch this whole video, but let's get started.
I have a confession. I have been in an affair since I was 17 years old.
Good for you.
I wish I could talk about butterflies in my stomach or maps I drew on the ground when I think about this affair, but I cannot. I wish I could talk about sweet words spoken or gifts that I received from this affair, but I cannot. All I can tell you about is the aftermath, about days I spent constantly asking, why me? I remember how it all began. I was in my final year of high school and my class had just won in the sports. So we were singing and dancing and hugging each other. I went and took a shower, then I went for dinner. And when I sat down to eat, my teeth started chattering. And so I couldn't put the spoon in my mouth. And I rushed to the nurse's office. And because I couldn't talk, I just pointed at my mouth. And she didn't know what was happening. So she told me to lie down and it worked. After a few minutes, the chattering stopped and I was about to dash out. And she told me, no, she insisted that I go up to the dormitories to sleep. Here I was in my final year of high school, just a few months from doing my end of high school exams, and a few days from doing a set of exams we call here in Kenya MOOCs, which are somehow meant to gauge how prepared one is for the final exams. There's no way I was going to sleep and let a set of exams MOOC me. I went to class, sat down, took my Kenyan history notes. And there was down Kenyan coastal town with the great Mekatilili Wamenza, the Giriama woman who led her people against British colonial rule. Then, without any notice, my left hand started jerking. And it was as if I was marking imaginary papers. And in and out it went. And with every stroke, one by one, my classmates stopped concentrating on their reading and started looking at me. And I tried really hard to stop it, but I couldn't.
Remember, as she talks, think about yourself as a teacher.
Because it had a life of its own. And then, when it was sure everybody was looking at us, in its final show and official introduction, I had my first full-blown seizure, which was the beginning of what has been a 15-year-long affair. Seizures are the trademark characteristic for most types of epilepsy. And every first ever seizure needs to be assessed by a doctor to determine if one has epilepsy or if it's a symptom of something else. In my case, it was confirmed that I have epilepsy. I spent a large chunk of my time in hospital and at home, and I only went back to do my final exams. I had seizures in between papers, but managed to get good enough grades to be admitted for an actuarial science degree at the University of Nairobi. Unfortunately, I had to drop out.
I'm stopping. You're going to watch it by yourself, right? You're going to think about the implications for being her teacher. What does that mean? What do you have to do for her mental health? What do you have to do because she's sick? All of those things. We talked about CP, right? Y'all covered that well. What we didn't talk about was sickle cell anemia. What is sickle cell anemia?
A blood disorder.
A blood disorder, right? Can you describe it to me? Anyone? Why?
Look up.
Sabrina, go. Someone go.
Hold on, I'm looking it up right now.
Can describe
it. You go, Jen.
So, well, there's different types. There's well, not to get like too into it, but there's like heterogeneous. So you have like some sickle cells and some like normal cells, like red blood cells I'm talking about.
So what's a sickle cell?
And then there's like homogeneous sorry, my internet cut out. Just basically it just means like your red blood cells, they're not like they're shaped kind of like sickles, like crescent moons. Yeah. And that can cause like blood clotting, and I think trouble breathing too in some cases. And I think it's pretty common in African Americans, if I'm not mistaken.
Yep, 95% of all cases occur in Africa. And your red blood cells are shaped like a sickle or a crescent moon, as you said. So they hurt. You hurt. So kids with sickle cell hurt really bad. So what does that mean for school?
Makes it hard to go to school.
You're going to miss a lot of school, right? And it's going to be your job to figure out how to not talk yet. I love this video. Yeah, it's going to be your job to figure out how to, well, the school will help you, but as a compassionate and loving teacher, you're going to think about what you can do for that child, right? And we're going to watch a bit of this video just because I like it and I want to watch it. And then you guys will finish watching it without me.
When the other kids used to go outside and play, I would try to do that. Then I come home and very sick and have to be back in the hospital.
17-year-old Alexandria Young of St. Louis, Missouri, has sickle cell anemia, among 72,000 Americans with the disease.
Among all Americans, approximately 1 in 1,500 to 1 in 2,000 newborns will be diagnosed with sickle cell disease.
In people with sickle cell disease, their red blood cells become deformed, turning sickle-shaped. The bone marrow tries to make more red cells to make up for the loss, but can't keep up, causing anemia. Their new shape keeps them from moving properly through the body, and the misshapen cells can jam up and stick to the walls of the blood vessels. These clumps cut off oxygen to healthy tissue, delaying a child's normal growth and causing fatigue and extreme pain.
It's like a hammer beating at you like for a long time.
I never heard anybody scream that high and just wail out and
And we were like, what's wrong? What's wrong? And man, she would have it so bad where her eyes just roll back up, just roll back and just in pain, just screaming, yelling. And we didn't know what to do.
And I thought she was just talking in her sleep or something, but she had mentioned that she was ready to go home. And I said, Alexandria, you are home. We're home now. She said, no, Mommy, I want to go to heaven. That's my home. And
okay, deep breath.
Dr. Michael DuBon has been Alexandria's hematologist since she was 4 years old.
So you can watch the rest of it. Think about when you have a child in your classroom. So it's more than just the sickness, right? I guess that's the point that I really need to drive home, is that there's just the emotional component, there's the social component, all of that you have to think about when you're teaching kids. So this is the prevalence. It's small, with the exception of asthma. Even epilepsy is less than 1%. I think when you teach special ed, I suppose that's why I knew so many kids that had seizures. So what causes health disorders or physical disorder? The things we've talked about today, tell me what you think causes them.
I know it could most likely be like genetic or hereditary.
Yeah, genetic, hereditary. A lot of it, right?
Or also like, I'm sure some of these things can be caused by like prenatal stuff, like not being taken care of prenatally.
Well, back to that, take care of yourself prenatally. Get the word out for people to take care of themselves, right? What else? Injuries. Sometimes it can be caused by injuries. So this says you can help by making sure that when kids are sick, that we send them to the school nurse. And don't ignore anything. I told you about the little boy that was, or he was a middle school kid that I knew that was limping. Have I told you that story? I was his counselor. He came to my office limping, and I'm like, why are you limping? I got hurt out there on the football field. Okay. So this went on for like 2 weeks, and I kept saying, why is he limping? And so finally, a colleague of mine, he spoke Spanish. So, or his family spoke Spanish. I did not, and she did. So she called his dad, and his dad came, and they took him to the doctor, and he had a brain tumor. So don't ignore things. Pay attention. That's the message of that. Use disposable gloves and a mask. We're much better at this than anytime I've ever looked at this slide before, right? I'm trying to see what's super important. Typically, these things are assessed by somebody other than the school, right? A doctor. They come to you with that. Testing accommodations will come with their IEP. Typically, there are things like extra time. There's a lot of things, though, with kids who are sick, right? So you could have accommodations where they get instruction at home, which we used to think was a big deal. But is that a big deal anymore? What are you doing right now? I am instructing you at home, right? And it's really important that when we do home instruction, if it's at all possible, that they're around their peers, just like we are now. Instead of just one adult with one child, they get lonely, right? Yeah, those are the big issues with testing accommodations. Early intervention is the key. How old? So if a child is born with a physical disability or any other disability for that matter, when do we start with special ed? How old are they when we start special ed? We write a family support plan when they are?
I think it's 3 years old.
3 is when they can come to school. But when do we, yeah, tell us, Emily.
Right from birth.
Right from birth. As soon as we know something's going on, we start providing services, right? It looks
Can
a
I
little
ask a
different.
quick question about that?
Yeah.
So if they can pick up like a disability, like I guess if it's prenatal, like how they can do a scan to see, do they typically, like obviously they would tell the mother now, can she start receiving information and like plans while pregnant?
Excellent question. I don't know the answer to that. I would assume so. We always say birth to 3. That's a really good question. We should change it, right? To negative 9 months to 3 or whatever it is. Yeah, I would think so. The services that happen from birth to 3 are really interesting. They usually go through the school, but they're usually provided by a community agency. And then when they come to 3, we have an IEP meeting and bring them to pre-K or preschool, whatever, preschool. So I don't know that much about birth to 3, but I've always been intrigued. So I would hope so. And I know that we have within the law, there's a component called Child Find, which means we have to reach out to kids that we know have disabilities in the community. So yeah, that's an excellent question. Sometimes they need flexible schedules, they need more time, they need extra assistance. And this is so true right now in the middle of the pandemic when you think about online instruction and kids with any disability, right? Same stuff there. What's database practice mean? What are database practices?
Doing things that have been proven to work.
Yeah.
With data, through data.
With data, right, exactly. Supported with research. So with that, I only have 2 things here. So ADA requires accessibility. You have to be able to, I always think about this at Rutgers. Imagine we're in a classroom. Do you think a wheelchair would fit between the 2 rows of chairs? That's typically where I teach this class. And every time I get to this slide, I'm like, except unless you're here. But we would have to move the chairs, right? I mean, and that's just not cool. And you wouldn't move the chair when they came in the room for someone in a wheelchair, right? You would be prepared for those things. We have to provide barrier-free environments. Technology is huge. A lot of people, for example, with CP can't speak. So they can use devices that they speak with, and down to low-tech things like a book holder, right? Built-in spoons, all of those things. I have a dog that's fixing to bark. Just want to tell you, she wants me to know that it's time for you guys to be off the computer. As we teach kids with all disabilities, but especially physical disabilities, we're always thinking about transition. In their IEP, when they turn 14, we have to discuss transition services. What is that? How are we going to teach them to function in the world with their disability? And that's our job. And we need to talk more about related service providers. When you have a child with a physical disability, you're going to be best friends with the physical therapist, the occupational therapist, the school nurse. What's the difference between a physical therapist and an occupational therapist? Physical therapists work with large muscles or small muscles? Y'all don't know.
With what?
Are you joining my class?
Yeah, let me participate. What?
Physical therapists work with large muscles or small muscles?
Physical therapist?
Physical therapist.
Probably both, right? I don't know.
Second year of a master's program. Physical therapists work with large muscles. They're the people that help you when you break your leg, learn to walk again, right? That's what I always think about. Occupational therapists are about fine motor skills. The school nurse will be your friend. What about families? Who do you think knows the most about a child that has a health disability, about their health, their physical disability? Emma, tell me the answer.
Wait, say again.
Girl, I can't keep repeating the
My
question.
bad,
We're
my bad,
late.
you're
I've
right.
already kept them 6 minutes over.
My bad.
Who knows the most about a sick child?
A doctor.
The mother.
Oh, the mother.
Their families, right? Families need to be your best friend. The nurse needs to be your best friend. Questions? Wake up. Thoughts? Comments?
Just say so. Okay, sorry.
I'm gonna have to ask her to leave the room. What are you gonna do that's fun for the rest of the evening? Someone say it.
Order in.
Thank you. David's going to order food. I'm down. You're going to watch the election?
I've been.
Yeah, you have been. It has not changed. All right.
Keep waiting for Nevada to do something.
Yeah. You're welcome. I guess next week when I see you again on Tuesday, we will know who our president is, right? That's cool. All right. Unmute yourself and say goodbye. Bye.
Bye,
everyone.
Thanks for hanging out.
Thank you.
Thank you. You're welcome. Have a good night. Stop share. It's recording.